Hello again, AP students. This is Mrs. Politsky, and I have got your short answer questions for Chapter 13. Question number 1. What is the common element of all therapies? Well, the common element is to establish a relationship that focuses on improving mental function. Number 2, name the 4 tasks of the therapeutic process. That is to identify the problem, determine the problem's cause, make a prognosis or prediction, and to choose and carry out a treatment. Question number 3, explain how a clinical psychologist and a psychiatrist would likely approach the same problem differently. Clinical psychologists would be more likely to use behavioral or cognitive therapies, where a psychiatrist is more likely to prescribe medication. Number 4, briefly explain the biomedical approach to treating mental illness and to provide 2 examples of this type of treatment. The biomedical approach focuses on the brain, especially with drugs, and 2 types of treatment would be psychosurgery and electroconvulsive therapy. Number 5, the psychodynamic therapy is a type of insight therapy because the goal is to help a patient understand the cause of his or her problems. Number 6, briefly explain how psychoanalytic therapy works. The patient relaxes and the therapist passively listens while the patient says anything that comes to mind, hence free association. Number 7, briefly explain client-centered therapy. This is a humanistic approach to treatment developed by Carl Rogers, emphasizing an individual's tendency for healthy psychological growth through self-actualization. Question number 8, name the qualities of therapy used by Carl Rogers that have been found to produce successful results. This would include qualities of empathy, positive regard, genuineness, and feedback. Number 9, which type of psychotherapist is most likely to use systematic desensitization, and how does that work? Behavioral therapists, they create a hierarchy of the fear, which they gradually address. Question number 10, taking a drug that a patient becomes nauseous when consuming alcohol is an example of aversion therapy. This is a type of classical conditioning technique. Number 11, rational emotive behavior therapy believes that the cause of a psychological problem is what, and that is irrational beliefs. This goes back to Albert Ellis. Number 12, how do antipsychotic medications work? Well, they reduce the production of the neurotransmitter dopamine. Number 13, what drugs are commonly prescribed to treat bipolar disorder? And that would be lithium or divalproex sodium, and that would include things like Prozac or MOA inhibitors. Number 14, what alternative strategy is being tested that may minimize the side effect of electroconvulsive therapy? And that would be transcranial magnetic stimulation. For the most part, you would be using high-powered magnets, and you're directing them to stimulate certain specific areas of the brain. And our last question, number 15. Deinstitutionalization involves removing patients from mental hospitals whenever possible. Thank you very much.